the rush to accommodate those who are changing gender, those who would like to change gender, or those who have already changed gender, American society has really experienced a lot of confusion. And one of the things we've started to do is use the terms gender and sexuality interchangeably when really they are two very, very different concepts. In fact, LGB, the lesbian, gay, bisexuals, can identify and really empathize with the plight of gender identity disorder, but they don't want to be confused or associated with the QT plus side. This is the DSM-4 and DSM-5. They are diagnostic manuals used by psychologists and psychiatrists. They have every psychological disorder known to us listed. Gender identity disorder is in both, along with a list of the symptoms, how to diagnose it, etiology, epidemiology, and a little bit about what treatment modalities have worked. Homosexuality is not listed in either of these. It's not considered a disorder, it's considered normative behavior. It was listed in the DSM-3 around 1980, but it was listed as a paraphilia, which is really just a preferred means of sexuality. It's not a disturbance of self. It's kind of like a fetish, like some guys have a thing for shoes. It was dropped out of the DSM-4 after the Pride movement, when being gay or bisexual became more accepted by society. Just like two parents used to stay together and not divorce because the stigma of divorce was so hard on a child. But now society's changed, and we have a whole bed of empirical literature that says it's actually healthier for the child, for the parents to separate, so the child doesn't grow up in that tension with those role models of relationships. So gender identity disorder is a very pervasive disorder. It's one in which the person believes that they are trapped in the wrong body and that their body has betrayed them. It's treatment resistant. It's very difficult to treat. And these people know from the time they're 4 or 5 that something's wrong. I've had patients that can remember from the time they were 4 saying, "I'm a girl," when biologically they were really a boy. It's cost society a lot. The price of retrofitting bathrooms and locker rooms to make things safe, the price of crime rates going up. GID, they have a much higher rate of violent offenses and drug use. Homosexuality, that population is actually giving to society, right? Historically, gays move in, property values go up, right? Socially, they actually often have a better sense of self than heterosexuals. Statistically, they're much less likely to be involved in any kind of crime or drugs. And financially, they actually perform better than heterosexuals and have a lot less debt. So in this epidemic of transsexualism, of gender identity disorder, we need to exclude homosexuality, the LGBs, and make sure that we're actually making sure that the children with GID are getting help. Because even if they aren't experiencing the true disorder itself, to identify as a different gender means that they are experiencing some kind of discomfort, whether it's anxiety, depression, a personality disorder. We need to get them help for the benefit of society. We need to get them help to have a healthier America.